Hi.
Hi, ma'am. Am I audible, ma'am? Is the voice
Yes.
clear?
Yes. How about my audio?
Yes, ma'am. It is clear. So you can you can present, ma'am, just to make sure that your PPT works.
Yes. Yes, absolutely. Share screen. Host to disable participant screen sharing. I think you have to make me co-host or give permission.
Yes, ma'am. I'm doing it.
Specifically, one slide I wanted to check because it has a video in there. Still, it is not allowing the screen sharing. The host now.
Ma'am,
Okay.
I made you the host, ma'am. So I'll try to, if at
yes,
all.
it is coming up. Yeah, it is there. I'm going to share it right now. So yes.
Yes, ma'am. It is visible. You can you can go onto full screen. Yeah, it is working now, ma'am.
Yeah, so good. I wanted to check the audio here. Is it working?
Ma'am, I can't hear any audio, ma'am.
Yeah, one moment.
The healthcare workforce is constantly adapting to these
Yes,
changes.
the audio is coming now, ma'am.
Okay, once again, I share screen. There is a share sound. Kathy, I'm in WhatsApp as well. So in case if there is a issue in audio or video, just let me know.
Sure, ma'am. I'll text you.
Yeah. And one more, check this video here.
The healthcare workforce is constantly adapting to these changes. The healthcare workforce is constantly adapting.
Is it coming audio now?
Yes, ma'am. The audio is clear, ma'am.
Perfect. Yeah. Good then.
Ma'am, we'll wait for the participants to join, ma'am, for 5 minutes. And after we get a good amount of participants, we can start the webinar.
Absolutely. No problem.
Sure.
Kathy, you're admitting people, those who are in waiting as well?
Yes, ma'am. I am continuously on this, ma'am.
Yes, please.
Yes.
Welcome, everyone. I hope my audio is clear. And thanks for joining today's webinar on simulation enhanced interprofessional education. And my great thanks to Society for Healthcare Simulation, and thanks to all who have put effort to conduct this webinar from GSL Medical College Simulation Center. Myself, Princy Fernando, I'm a nurse midwife, simulation enthusiast, and I'm working as an educational services developer with Lateral Medical. And it's been 8 years of experience in supporting and developing faculties in conducting simulation-based education. And currently my role involves in developing modules online for simulation training. So I'm very interested in interprofessional education. So thus it is my happiness to share the topic regarding the simulation enhanced interprofessional education. So today we are going to look at what is interprofessional education and what is simulation enhanced interprofessional education and its details. And also we will look at the competencies that we require from the interprofessionals. We will also see and focus on the best practices for healthcare simulation prescribed by INEXCEL. And we will focus on the theoretical and conceptual framework and how to design and develop simulation interprofessional education, and to also see what is the barriers or enablers, and how to do the evaluation for simulation in IP. So with that, I would like to give a glimpse of what is IPA.
The healthcare workforce is constantly adapting to these changes in demographics, technology, and population demands. There are more different healthcare professionals involved in care for a single patient than ever before. More than ever, there is a need for these different professionals to collaborate. The concept of different professionals working together is called interprofessional collaboration, or IPC. IPC has become a pivotal skill for all professionals. IPC contributes to patient outcome, efficacy and safety, as well as to sustainability and job satisfaction. Just like other important skills in healthcare, the tools for IPC must be acquired during training, both pre-graduate as postgraduate. Education that aims to prepare students and staff for IPC is called interprofessional education, or IPE. When working on a patient, though, all different healthcare professionals will form a landscape of practice in which they act together. Preparing students for this landscape of practice requires interprofessional education that takes several priorities into account. These priorities are professional identity, in which the student in a community of practice learns about his identity and the kind of professional he can and wants to be. Interprofessional identity, in which the student in a landscape of practice learns how his identity relates to the identity of other type of healthcare professionals. Interprofessional workflow, in which the student learns how to move through the landscape of practice and how he can work together with other types of healthcare professionals. Interprofessional organisation, in which the student learns in a landscape of practice how a good organisation contributes to good healthcare. For example, what kind of conditions, infrastructure, working culture in the organisation are mandatory to be able to give good care. Time for one healthcare professional to work in solitude has long passed. IPC is now the standard, and IPE is needed to train the next generation of collaborating professionals. The healthcare workforce.
So with that, I would like to say that identifying one's own professional role, and also to see how with the other professionals they can mingle and work together in a collaborative way. When it comes to simulation enhanced interprofessional education, that is when participants and facilitators from 2 or more professions, it is not only the participants, also the facilitators for the simulation, engaged in a simulated healthcare experience to achieve a shared or linked objectives or outcomes. So this is pretty much similar like our simulation. And when we ask ourselves why we need this, it is the patient that needs are getting more complex, it is getting multifaceted, and it is getting challenging as well. We wanted to provide a safe, timely, effective, and equitable healthcare to all. And with that, it also applies to, sorry, is it my screen visible?
Ma'am, 1 minute.
Okay, I'm just waiting for the screen sharing permission. I show my screen again here. So the simulation enhanced interprofessional education is applicable for all the healthcare team members. With that, when it goes for interprofessional simulation, what is that we are expecting? Because we need some collaborative practice. When multiple health workers from different professional background work together with patient, families, and communities to deliver the highest quality of care. So that is what the collaborative practice that we are expecting. So saying that, I want you to have some throwback. So if we are worked in a team, it could be your sports event or in any projects in school or in your workplaces. What was your first experience being in a team? Here I place some of the questions. How were decisions made? Who had the power or control? How that was decided? When there was difficulty, how did people address that one? How did they express anger or disappointment or any emotions? How the team or the people listen to understand each other? So think about your first experience working in a team, and I want you to reflect upon now in a healthcare team. Ask yourself with the same question. And I would very much like to, get your thoughts in the chat box, because we open the chat box to everybody, so you can text and record your thoughts. Was the experiences different or are they similar? Do you see any pattern of your own self? How did you contribute within the team according to your role? Or did you see any differences? Did you follow any style or pattern for collaboration? How did that go for you? So I request Kathy to look into the chat box, and if any responses, we would be very happy to see your responses.
Yes, ma'am.
Yeah. It is not necessarily to answer for all this, but whatever comes as a first thought to you, please free to share with us. Super. So let us move ahead with the further interprofessional competencies. Now we reflected ourselves with what kind of similarity or the pattern, the collaboration work that you did, either it was non-clinical or in a clinical area. I wanted to present here with the interprofessional competency. When it comes to this, the first and foremost is values and ethics. The ethical practice within healthcare is classified as the standards of practice. We all know that. And we take responsibility as a health professionals to hold it with our patients and our colleagues. And we need to establish safe environment and structure to express different opinion and viewpoints. There should be a mutual respect. The second one goes to the roles and responsibility. I hope you all agree with me that no single health profession is capable of meeting all patient needs. Then the moment we know about other professional roles, the more we will get to know how we operate within each other, and we will be helped to function as a team. Mainly when there is a conflict arises, it is most of the time when the professional stepping into other roles and there is a role blurring happening, and it might lead to a team dysfunction and burnout. So we need to focus on the patient need primarily, so we can reduce the perceived conflict on roles and responsibilities. The third one goes for the interprofessional communication, which is a central concept of many interprofessional framework, and which is a core function as well when it comes to a collaboration. So whenever there is a poor information transferred, it is closely linked to the poor patient outcome and potential harm. Skillful communication can enable individual to overcome these differences. When it comes to team and teamwork, the collaborative practices is the center, and it not only refer to the health professionals. I wanted to repeat this again. When it comes to collaboration and teamwork, it not only refers to the healthcare professionals, but also it refers to the patient, family, and community to provide effective healthcare. So we need to really see how we work together and forward. So saying this, the values and ethics, roles and responsibilities, interprofessional communication, and teams and teamwork, which is a core part of interprofessional collaborative competency. The IPAC, Interprofessional Educational Collaborative, they have suggested a specific competencies for each of this in a various domain. So the values and ethics, when we go, we have to, as a healthcare professionals, we need to promote the values, and we have to advocate for social justice and uphold the dignity, value the diversity, value the expertise of the healthcare professionals, collaborate with honesty, and practice the trust. Again, my screen sharing is stopped.
It's very important piece of information. Make sure to include all the keywords of your research.
Yati?
Ma'am, if you could give me the request of PPT, I'll allow, ma'am.
Sorry?
If you could give the request to share the PPT, I could share, ma'am. So
I don't know how that works, because how do I do that?
ma'am, if you could put a request, ma'am, to share the PPT, I'll accept it, ma'am.
It is not coming up. It is coming up as host disabled participant screen sharing. Is it possible to make me?
Ma'am, give me 1 minute, ma'am. Just a minute. Ma'am, if you could present now.
Okay, I'll try again. Yes, I could share my screen now. Very good. Thank you so much. Yeah. When it comes to roles and responsibilities, again, it is what we aim is the team member focus on the patient-centered care and collaborate with the team for improved health outcomes. And they differentiate what the team members' role are so that they can appreciate it and practice cultural humility and interprofessional teamwork. And when it comes to the communication, it is very basic, which is communicate clearly and use tools and techniques which are very much available, which I will share in the following slides. And when also we wanted to have the shared mental model or the shared goals within the team, when it specifically when it comes to communication. And without active listening, the communication will not be complete. And we need to use constructive feedback. And we need to also see as within the team that how we manage conflicts. So these are the specific competencies which are, been suggested, and it has been revised in last year, 2023 as well. I wanted to just specify that. When it comes to team and teamwork, and we all know that, the team formation and development and the continuum of the practices, teamwork is very key. And that we, as professionals, we need to see what are the evidences available. Is there any processes which are there, which we can adapt for the team? So let us look at and describe those within our team and appreciate team members' diverse experience and expertise. Practice team reasoning, shared leadership practices to support team effectiveness. Many of us are so used to our simulation and ACLS protocols. So we know that what is the shared leadership practices are. And there are practices of methods for conflict management. So apply them. Reflect on self and team performance for the effectiveness of the team. And last but not the least, share team accountability for the outcomes. So these are the competencies that I wanted to share with you. And it is also been described in Excel, which is International Nursing Association for Clinical Simulation and Learning. They have provided the standards in various components, starting from professional development, preparation and briefing, how to design simulation, and so on. However, the one which I wanted to focus here is the standards of best practice in simulation includes simulation enhanced interprofessional education. So we will have a deep dive into this. And including, there are 4 criteria, and there are elements to it to meet this criteria. To read it out loud, conduct simulation-based interprofessional education based on theoretical or a conceptual framework, and utilize best practices in the design and development. We don't have to start from the scratch. There are different models available: crew resource management, crisis resource management. There are different models available. So we can adapt, utilize those for simulation and interprofessional education. We also need to recognize and address the barriers which comes in our way. And also we need to look forward to the evaluation plan, because without evaluation, we cannot measure the progress and keep continuing the best practices that we do. So we will have a deep look into it. We will start from the first criteria, which is the theoretical framework and conceptual framework. So here, I have taken the liberty to take this material from IPE. So here, this framework is focusing on 2 main areas. This was developed by D. Amar and Anderson, and they constructed a detailed graphic, as you could see here, to illustrate how interprofessional dependency between health professional education and healthcare professionals' collaborative practices are. You can see both the circle, which talks about how educational system, and at the macro level, how it also implies on the collaborative practices when it comes to the field work, or we would say clinical work. This framework establishes the linkage between the determinants and processes of collaboration at several levels. We can see that it includes the links between the learners, teachers, professionals on the educational system side. And it also links with the organizational level between the teaching and the health institutions. Because whatever we do, see, act on simulation, we want the transfer of practice in the clinical environment as well. And the author mentioned here that interprofessional practices will not be pursued without a politics. So I really wanted to highlight this, because as I could present on the next slides, you will also see how that creates an impact in education as well as collaborative practice. And this is from WHO, the framework for action on interprofessional collaborative practice. And again, here, if you see, this framework, which got evolved, I would say, after almost 50 years of inquiry, and now they have a very good sufficient evidences to indicate that interprofessional education enables effective collaborative practice. Thus, it optimizes the health services. It could be the tertiary level unit, or it could be a urban health center. So the framework fits all the region. And when we look into it, we will also need to see that there is a appropriate use of specialists in clinical resources got improved, and the health outcomes for people with chronic diseases and patient care and safety, the foremost, it got improved. And the collaborative practices when the health professionals, when they do it, and it also decreases the patient complications, it decreases the length of hospital stay of the patient, conflict among the healthcare providers, staff turnover, and clinical error rates, and finally the mortality rates. So it do have a benefit when it comes the interprofessional education and the collaborative practice when it transfer. So there are different models available. One is the team steps, the team strategies and tools to enhance performance and patient safety. It has a key principles based on this team structure. As you could see, there are 4 teachable and learnable skills, which is communication, leadership, situation monitoring, and mutual support. And these are based on the outcomes, like, how the interaction between the outcomes and skills are happening, and how we encircle, all these 4 skills is the team structure. Okay, the team structure which encircles all the 4 skills, and which is not only represent the patient, but also the caregivers, our students, our providers, who play a supportive role within the healthcare delivery system. So team step is an evidence-based framework to optimize team performance across the healthcare delivery system, I would say. But by seeing these components, which is we can able to teach, we can able to practice leadership, mutual support, communication, and so on. There is a guidebook from Team Steps. It is available in the web page, and it has given a very good tools and guidance which can be adapted within any team members of healthcare. So if I if I throw some light to this, for communication, we all know that SBAR, introduction, situation, background, assessment, and recommendation. And there are different tools like communication, call out, check back, especially when there is a administration of medication, or if there is a transport from and how the transport and the handoff techniques are used. So these are the skills, very much important for patient safety. When it comes to leadership, the team step tool event, which is brief, huddle, and debrief. So we want our students or our healthcare professional to practice this team event before they start performing certain tasks as a team. Situational monitoring includes situation awareness, monitoring not only the patient, the team, the environment, and the progress, and having a shared mental model. When it comes to mutual support, it is task assistance, how as a individual in the team, we assist each other, and how we are open to feedback, and so on. Here, I wanted to present some of this tools, which I could see it in the team step. I am safe checklist. Have you heard of this before? I hope many of you. Yeah, good then. So it is within the team, each member has the responsibility to assess by themselves and then say that, okay, I don't have any illness, I'm not taking any medication, I'm not stressed, no alcohol, no drug, fatigue, no problem with not having food or need to use the restroom or other things. It is safe. I'm safe. So I'm going to participate in the team care. And the other interesting one is when it comes to mutual support, if there is any conflict or patient safety threat, we can use cuss words. What are those cuss words are? I am concerned, I'm uncomfortable, or there is a safety issue. The moment in the team, any of the team members says any of one of these words or the statements, then you have to stop the management as a team, and then you have to really look into it. So these are the statements which helps the team to be assertive and to be there to provide support mutually with each other. And yes, the dear conversation when it comes to difficult situation. And I believe this is not only for a professional conversation, but also it can be applied in personal life, difficult conversations as well. So the dear goes for whenever you say there is a different of opinion or actions, then you describe within your team member specifically what you have saw or heard and explain the impact of the situation that is caused. Ask to hear their point of view because we wanted to uncover what was in their mind as well, and request a change for the future. Make it practical, what could be done in a better way. Okay, so this is helpful. And the other teamwork theory, which is from Tuckman, which is a 5 phases one. I saw this graph, which is a very interesting one, which started with forming till performing. So the forming is the initial stage, and this is the time when the different individual of the team come together, and then they busy finding their place in the teams. They wanted to ask themselves why they are here, and then wanted to clarify things and etc. But when it comes to storming, this is the time the actual talk is happening. And this is the time they challenge each other. They try to agree, disagree, manage the conflicts, and they come to a conclusion in a way that how they wanted to manage the patient care aspect. Most of the time, the conflicts are resolved here, and then goes for the norming. This is a phase where the team members start to come together, developing the progresses, establishing ground rules, clarifying who does what. For example, who perform the vital signs, who does the documentation, who notes or notify the consultant, etc. So this phase is characterized by a growing sense of togetherness when it comes to norming. And the performing, once people are together, agreed, the performance starts. And the last one is adjourning. This happens at times when team got another task. They have to move from one team to the other team members, especially in healthcare. So however, it is repeated, and it also gives improved healthcare delivery as the relationship grows. As you could see it in the graph, the more the good relationship between the team member, the focus is on the task is getting increasing, and the performance can be expected in a better way. Here, when it comes the curricular design, now we are focusing more towards this in Excel standards to the element. The main, I would say the main focus we need to provide is need assessment, how to integrate the interprofessional learning, especially the objectives that we set for when it comes to simulation and the curriculum design. So incorporate the learning models, adult learning principles, which is the basics for simulation. Gather data, what is that you wanted to achieve in your ICU or within your final year MBBS, nursing and physiotherapy students when they come together as interprofessional learning. So create mutual learning objectives, including teamwork. So that should be the primary focus of it. Then we will see how we can use or create appropriate teams which aligns the different level of learners. So we need to make sure that the communications are proper between the different professionals, and we need to align the objectives, and we need to have a role clarity. Okay, if I'm going to have maternal focused interprofessional simulation, and who are going to be my learners? Is it going to be from physiotherapy, nursing, or medicine? Then what are the learning objectives, how it remains common, and also how it goes professional specific. So these things we need to look into it. And we will definitely integrate team concept. I presented you in the previous slide, there are different tools. Team Steps provides tools, and we need to see that the simulation activity is based on the competency, which is described as values, ethics, roles and responsibilities, communication, and teamwork. Then once we develop the simulation, we need to also see how the assessment are going to be. So what the suggestion from the expert is, we can avoid the high stakes summative assessment. Probably we can focus more on formative assessment so that the learner feels safe in the simulation environment, which is the basic. And we can focus on clinical and communication. I mean, the IP competencies, both in a simulation. So that is helpful because we may not conduct simulation separately only for the interprofessional competency, but we always conduct simulation focused on the clinical components. It is also good to integrate those into it. And I cannot go with my slides without presenting the circle of learning. When it comes to learning, we need to see the outer circle, which always starts with the healthcare quality improvement, because we are here for simulation, or we are here for learning because we wanted to improve the health of the customer. And which starts again with the knowledge, skills, and when to do, what to do, or how to do, and putting all this together in simulation. So if I wanted to align this circle of learning with the interprofessional education, I can think of this one. When it comes to interprofessional education, we can have a e-learning or classroom teaching or flipped classroom method, which is very effective as per the research to introduce collaborative care and competency and team steps, etc. We can also have small group activity, role plays, games, problem-based learning for teamwork, communication, and conflict resolution. There are ritual simulation and case studies to help the team members to make critical decisions. Then we can expose them to simulation, interprofessional activity. When they come together as a team, they work together, learn together. And in situ simulation, when it goes to the clinical environment, the team can able to apply what they have learned from all this component, from knowledge to simulation, and then they can even participate in situ simulation, or probably if there is a in-service participants and or learners, we can also see real clinical event debriefing, which is again helpful. Any questions so far? I can just, yes, okay. Kindly post it in the chat box, and then we would be happy to address it in later time. So let us focus within the circle of learning, especially the simulation in teams. We all know simulation is an artificial representation of complex real-world process with sufficient fidelity, the realism that we wanted to aim it with the fiction contract. And we wanted to facilitate learning because we want the participant to immerse themselves. When they immerse, they perform tasks, they do action. When they do that, we as facilitators, we can able to discuss it in the debriefing. We can reflect it, why they have done what they have done, and we can provide feedback. And there will be minus and plus, plus delta, and how we can see that in real life. And then we can always connect the learning to the real life situation or scenario. It is a technique, not technology. So rather than just a technology, right? Nowadays, technology also prominent when it comes to simulation, but especially we wanted to promote experiential and reflective learning in simulation. Oh, what is the key for implementing simulation, especially in interprofessional? We wanted the double loop learning to happen. So we want to achieve that as an outcome. So we need to start somewhere, isn't it? Preparation and briefing, which is very key, I would say, equally to the debriefing. So many of the experts here would agree with me. Preparation and briefing is a very important part in the simulation, which makes it as a very less threatening, or I would say safe learning environment for the participants. And it is confidential. Anything that happens in the simulation stays here. It will not go out of the room. And yeah, the environment is comfortable, and we ensure the privacy during the scenario, because as facilitators, we stay away, mostly like kind of invisible to the participant. And we help them to prepare very well before they come to the simulation. And we clearly state them the objectives when it comes to simulation. So the facilitator ourselves, we acknowledge that the scenario is near real. It is not real as clinical, but there will be few gaps. However, the learnings are higher when it comes to the simulation scenario. So it is very important that as participants know that it is okay, to have some of the limitations within simulation, but they are here to learn and improve their practice in the clinical environment. So additional to the preparation and the briefing, the simulation situation, the stages that you provide during the simulation session, which need to be authentic and close to the reality. And when it comes to debriefing, it is the reflection which we would like to see. And overall, that we also need to have an assessment. We can look forward to the practical level of assessment. It could start from the reaction of the learners participating sim IPA to the level where the patient outcomes are measured. Yeah. With that, I would also give some glimpses around the scenario template. This is a 9-page document from NLN, and we can reproduce this by giving the credit to the NLN. And this very clearly describes, we don't have to think what I have to write in the simulation scenario, because it gives a appropriate prompt. That's what I would say. There are different templates available, but we can always adapt one. And the NLN template for interprofessional education simulation also provide learning objectives which are specific to the competency, as you could see here. So as facilitators, we would happy to have some guidance around that. And not only that, if we are having a simulation session, we can also think about what are the clinical component focused learning outcome we wanted to have. And this also gives a good list of articles and things, and what are the roles that we wanted our learners to play. So we can always have those information in the template, and what is a basic or reference for this particular simulation session. So if there is any pre-reading material or algorithms, protocols that we wanted to use it, we can mention it. So it is it gives the completeness to the scenario. And we all know that the template, the progression need to be outlined, like what is the timing, the start of the scenario till the end of the scenario, what will be the action or the findings in the mannequin or the simulator or the standardized patient, and what is that we expect from our learners to do. So this need to be clearly described. And the one thing which I really like about this scenario template is it also gives some guided questions to ask for during debriefing. And this is what the template is. So when we are it is okay to adapt and use it for our simulation session. So when it comes to debriefing, there are different models, 3 phases, 4 phases, 6 phases model. But overall, for me, it is basically clear the air in the beginning, guide the initial discussion, like, okay, so how do you feel after your simulation session? What is the learning objectives? Are we all okay to continue? Can somebody tell me like what you did in your session? So everybody are in the same page. Then we go deeper into the analysis by getting an understanding of what happened and why it has happened. We wanted to understand the frame of mind of our learners, their mental models, and we wanted to drive the learning based on that. It is not only discovering the mental models, but we also wanted to apply them. Okay, what if this happens in the clinical area? How would you like to, manage this conflict? Will you, follow the same process of conflict management in the real clinical environment if if the conflict arises with higher level competent people? And we also wanted to summarize at the end by discussing what was the take-home message or the key learning from the learners. So the debriefing needs to be conducted in a structured way. So here I wanted to just give some prompts and questions related to SIM IPA. When it comes to family-centered care, we can ask, how was the caregiver's perspective integrated into a care plan? How did the team or professionals support the patient or family cultural perspective and the family's beliefs? So we can talk about it. And when it comes to communication, what was the impact of the communication for the outcome that we got for this patient? And if it is a transfer of patient from ICU to the OT, how did that communication affected or created impact in transfer of patient from the ICU to the OT? Okay, so it can go on, especially when it comes to patient care, explaining things or counseling the patient. How did the language that we used with the within the healthcare team members as well as with the patient and the family? What was the impact of it? We can, these are a few other questions around the role clarification. And for the team functioning, what are the actions that, you as a team did to enhance the team process? And how does the barriers were addressed during the teamwork? So we need to explore and dig deeper, I would say, to understand how as a team they apply those competencies and different tools to perform as a team. When it comes to conflict resolution, again, is there any points that the team disagreed, and how did that got managed? Is there any conflict between the provider and the patient or the family? How was this handled or managed? These are the things, probably very time sensitive, because nowadays we could see that we get all Google taught patients. So it is important that our healthcare professionals, the team members are, being ready for this conflict resolution as well. When it comes to leadership, how did your team determine who would lead? How that was decided? Is it because of the knowledge, experience? How did the collaborative practices happened? Who made the decision? Was it the patient and family involved before we made decisions, or every time we made a critical decisions? So these are some of the questions that we can use it as a prompt during a simulation-based interprofessional education. So I wanted to hear from you. We talked a lot with design and debriefing, etc. So I wanted to hear from you. So please feel free to use the chat box to put your thoughts or maybe the answers.
Ma'am,
so
we
here
have
you are seeing
two queries, ma'am.
Yes.
One is from Dr. Archana More. So she says, can you please add more insights to virtual simulation or gamification in nursing education, madam?
Sure. We will talk about that. Yeah. So as you place the answers in the chat box, I will keep talking for the virtual simulation. There is a virtual simulation available, which is integrated. Gamification, I'm not very sure, because there are escape rooms, which you can read about. There is a trend coming up as a escape room, as a simulation. And virtual simulation is about it is the one-to-one. It is, they see the ritual team on their system, computer system, or it could be the augmented reality by wearing that glasses to see the ward or ICU and the different team members coming in and giving orders, especially in nursing. Like, we want, it is not always possible for different professionals to come together. So this virtual simulation is actually an aid. When you log in and then you're able to see the different doctors' orders and different professionals, like, okay, there is a due for physiotherapist visit, and the patient need to be sent for dental consultation and so on. So as nurses, how we plan the care to meet all this is integrated in the virtual simulation. That's what I could say. Dear is about more when there is a difficult conversation. You saw something very abruptly, the error to the patient has happened, or there is a safety threat, and you wanted to address it. So you wanted to describe it before whatever you have seen or heard, so that both the party are clear, and then you go for encouraging like why that has happened and ask their view, and then recommend for what could have been practically done for in the future. So this is how the during the conflict or difficult situation, we can use this as a tool. For me, it is more like an advocacy inquiry, but however, this includes the recommendations for in a practical way. So it is good. Yeah. Great. So going forward with this questionnaire. Yes, participate in formal training is the key, because we as debriefer, we want to be as a facilitator when it comes to simulation enhanced interprofessional education. We don't want to give them, okay, you did this correct, you did this correct, these steps were not done correctly, so you have to improve it this way. We don't want the dictators or lectures happening over there. So it is a good suggestion that we will advise this debriefer to take formal training in simulation. So the other question here, which of the following best describes as a preferred method to utilize while assessing the learners in Sim IPA? Okay. So your answers, please. We do have another 10 minutes more, then we are good. Yeah. Perfect. I hope you all have correctly judged it. It is creating a safe learning environment, because I wanted to see that assessment is not a formative or a summative assessment, but we wanted to have a good judgment of the actions that the learners do in the scenario, and we wanted to discuss it in the later time, the debriefing. So we wanted to really create the safe learning environment so that the participants or the learners do the actions which they think that is appropriate in that scenario. So these are some of the tips that you can look into it. And yearly orientation to interprofessional education is very important. That's what I would like to highlight here. And then when it comes to different roles and professions, we need to understand them. We need to question and clarify. And we need to focus on the need of the patient at the whole. And the trust is the key. A flipped classroom approach is a key in IPE, because when we kind of give the e-learning around the interprofessional competency, team steps, and etc., it is good for the participants to come to the simulation for their knowledge and skills enhancement, and we will get a good time to conduct simulation session. So the other points we really looked upon it. Peer learning is as effective as faculty learning when it comes to simulation. And the reflection among the facilitators when we perform or integrate simulation into the curriculum, we need to also review and reflect, and periodically assessment of the whole program also helps us. And the third component of INEXCEL standard talks about the barriers. When it comes to institutional support, identify the champions, like who are the drivers of the simulation, and make sure that there is a good pool of faculty, so that and also with a dedicated faculty time, so that there is no burnout doing the simulation, especially when it comes to interprofessional. And we also wanted to see that the faculty had the formal training, and also have the observation and mentorship and feedback continuously provided while they implement simulation in interprofessional. And we need to definitely trade for debriefing, especially when it comes to interprofessional. The advanced level of debriefing is the training is important, I would say. And we need to promote the collaboration in terms of having identified the different professionals, so that the different professionals come together and define what is the learning need for their profession, and then see what is the commonalities, and then integrate it into a simulation IP. Then we have this structure, because we all know that the simulation has a structure from preparation, briefing, scenario, and debriefing. So we need to see that properly it is executed, especially when we design the simulation scenario. It need to be pilot tested, peer reviewed, and so on, as you do any other simulation. And we need to include the learning outcomes, which is focused on interprofessional educational collaborative competencies. And I was talking about the political will, and the nursing curriculum is adapted to skills and simulation competency-based training, and also the EdCom module in medical curriculum few years back. And it all talks about the collaborative competency by the regulators, and having the clear goals and strategic plans, which are also enablers. And these are the other highlights that I wanted to just present. And this is from the article from the Indian author from one of the reputed institutions. So they did implemented interprofessional education for 5 years, and this article is based on the experiences of it. And from WHO, this is the interprofessional educational enablers, I would say: staff training, identifying the champions, institutional support, managerial commitment, the learning outcomes which meets all the professionals which are involved. We cannot avoid the logistics and scheduling, because the curriculum is already predefined, especially when it comes to pre-service. So how do we want to schedule and include it in pre-service or in service or during the clinical hours, etc.? What is the program content? Is it like a standalone program, or is it like integrated with all the simulation? Do we need a compulsory attendance? So on, we can go on with this. And this is an article which, this is a PDF document which the organizers will share with you, so that the key team steps and the core competencies, all of them, it is good to have a read after this session as well. And the fourth aspect of INEXCEL standard, which talks about the assessment, which is focused on the individual, team, and organizational. There are different tools available for them, and these are validated, reliable tool. So you can see TOSCI, ICAS, ICAR for the individual assessment. TOSCI can be also used for a team. So there are certain tools which you can apply during the teamwork, as well as during the simulation, as well as the individual person assessment, either in the clinical area or also in the simulated environment. And for the organizational, again, we do have a tool to measure them. How as organization they embrace the interprofessional education and simulation. One of the tool here from Team Steps, which talks about the team observation for the performance, as well as we have the TOSCI, which talks about Likert scale from 1 to 9. I really liked it with the 6 and 7, because at times when I wanted to score, I wanted to really don't want to score, but just not 5 also, but not a 7 also. So there is a score in between. But this has been adapted by another author, and she made it into a 5 scale of the same tool. So we can decide which one we would like to use it when it comes to our simulation session. These are the few considerations which we talked about it. We cannot deny any of this, from needs assessment to curriculum integration, planning the logistics, having the trained faculty, and conducting the pre-brief and debrief in a structured way with the evaluation process in it. There are very good outcomes in for simulation itself. So we don't have to, question about it. But when it comes to simulation, interprofessional education, we have an Indian author, Dr. Lulu Sharif. She has done this study among nursing and medical students, undergraduate students. They found that there is an improvement in teamwork and communication, and a positive feeling among participants about interprofessional collaboration. So this is really interesting to see how the awareness and attitude towards interprofessional session itself has got improved by the interventions they have provided. And yes, there are core competencies, which is recently in 2023, it got revised, and there are a few changes in a good way. I could see that just culture is mentioned over there, which is one of my favorite as well. And when it comes to, or when we wanted to have the result, okay, in a meaningful way, the IP needs to be integrated into the curriculum. It could be pre-service or it could be in service, with the participating IP experience. Like, it's not only the didactic session, but also the interprofessional educational experiences that we provided in a simulated environment or in the clinical environment. Both are highly need to be considered. With that, I would like to, just present here the guidance, because once we wanted to implement this interprofessional education, this guidance will help you in a broader perspective, how it can be integrated into health professionals education. And then if we wanted to work together, let's learn together. So that is my conclusion. And these are some of the references that you can look into it, and the organizers also will share with you a few of those documents, and very useful ones. Yeah. So thank you so much. If there is any questions in the chat box. Yes, we do have, mixed reality is coming up. Mixed reality goes with either having simulator or without simulator, both the way. So it is available in the market already. And we do have a virtual simulation. Yes, there are softwares, but you have to go for a subscription on the same. Yeah. And it can be used in academics, because it is all the virtual simulations, whatever I have seen or heard about, it is all integrated with the curriculum of nursing and medicine. So it can go very well with the academics. Yes. Yeah. So thank you so much. It was good interacting and having that interaction in the chat box with all of you. And wish you a very good night. Bye-bye. Kathy?
Ma'am, thank you so much for your time, ma'am. It was
Thank you.
actually very informative, and I think our participants were very enthusiastic in learning all the things that you have done. And surely, ma'am, whatever resources you have shared, I'll definitely share it with all the registered participants.
Please. Thank you very
Yes.
much. Yeah.
Thank you for your time, ma'am. Nice meeting you. Thank you, ma'am.
Thanks for the invitation. Bye.
Thank you, everyone. Thank you. Bye.
Thank you.